Chronic kidney disease in the United States is an enormous problem that is actually growing at really logarithmic rates.
Roughly in the United States, there's about 25 million people who have some loss of kidney function.
One of the complications of this is a rather unique form of what's called systemic pruritus, which is simply a fancy term for whole body itching and discomfort.
Pruritus usually starts when a patient has undergone dialysis for a prolonged period of time, although some patients do experience it early in the dialysis treatment.
Up to 90% of patients on dialysis have some degree of itching at some time or another.
The itching is terrible. I can hardly stand it. Most of the time it's unbearable.
When the itching occurs, you have to dig your skin. Sometimes you scratch yourself until it bleeds.
They suffer so much at home with not being able to sleep, not being able to interact, not being embarrassed because they were always having to scratch.
Pruritus affects their whole entire life. They say it's so bad that they want to scratch their skin off.
The itching is like under the skin and you can't get to it.
It's not like something on your skin, it's something under your skin. And you scratch it and it'll feel good for a minute, but come right back.
It affects you socially, it affects you psychologically, it affects you physically, and it increases the overall morbidity in patients. They end up with increased hospitalizations, increased cost of treatment, they have to be on antibiotics. It's a mess.
The itching has affected my sleep, right? Because I would wake up maybe every hour.
Terrible, in the middle of the night.
The pruritus can be so severe that at night they're unknowingly scratching themselves, obviously, and because of bacteria on the surface of the skin, these bacteria can be inadvertently introduced into the bloodstream, causing everything from infected dialysis catheters to infections of the heart and some very, very serious long-term complications.
Some of the patients have sores on their skin because they scratch so much from the itching, and it's bad. It's not just a simple itch.
There's this desire and need to scratch harder, and as a consequence, people can do considerable damage to their skin.
We actually had one patient that lost his access because of the scratching.
Well, I tried lotion, I tried anti-itch creams, everything that I could get my hand on, but it's all temporary.
The itching will always come back. That's the whole problem. If the itching comes back and nobody finds anything for it, I will go like this for the rest of my life.
You want to help them, but truthfully, I've been doing this since 1995, and the unfortunate thing is there's no magic answer.
We have a lot of things we do, but most of them are not very effective. Antihistamines are useless. We know that. We've tried that many times. All it does is give the patient more side effects, more pills to take. They have a very large pill burden to begin with, and it doesn't work.
He just told me there wasn't nothing he could do about it. And he was right.